Calls to reform Maine's child protection system are getting louder following the death of a 1-month-old boy in Milo this week. Police say Silas Melvin was killed by his father, Reginald Melvin, who is now the 4th parent to be charged this year in connection with a homicide involving a child. To increase public transparency, the Department of Health and Human Services has just released a new state report which focuses on 143 child deaths since 2007. Those grim statistics come at a time when the state's system, charged with protecting children at risk, is at the center of 2 ongoing reviews. News Center Maine's Vivian Lee has more.
After the death of 4-week-old Silas Melvin this past weekend, there is fresh scrutiny of Maine's child protection system.
Poor little Silas up in Milo, only a month old. I mean, these deaths, they're just tragic, and I think they're preventable.
The tragedy comes after 4 child deaths in just 21 days in June, including 3-year-old Maddox Williams. Police say the toddler from Stockton Springs was murdered by his mother and had been in and out of the DHHS system. Those deaths prompted State Senator Bill Diamond of Windham and other lawmakers to direct the legislature's Special Office of Government Oversight, known as OPEGA, to investigate the DHHS Office of Child and Family Services. It's only been a few years since the agency was under fire for the deaths of 4-year-old Kendall Chick and 10-year-old Marissa Kennedy at the hands of their parents and caregivers. Despite DHHS caseworkers being repeatedly involved, the girls died after prolonged and severe abuse.
I think the problem is clear, and that is the system is broken.
On a Zoom call with members of the legislature's Health and Human Services Committee, DHHS Commissioner Jean Lambrou said the department is working with law enforcement agencies in all of the child death cases. The agency also released a new report detailing the deaths of 143 children since 2007 and DHHS involvement, if any, with each of the cases.
We are committed to change, and that includes increased accountability.
Of the 143 deaths, 30 were determined to be homicides by the state's medical examiner. 18 were attributed to sudden unexplained infant death, and 26 were accidental. The remaining deaths resulted from co-sleeping, when a sleeping adult inadvertently smothers an infant, and natural causes. DHHS has hired a national child welfare organization, Casey Family Programs, to assist in investigating the 4 child deaths in June.
They're looking at the individual cases, and they're also then taking that and extrapolating it out to the larger system of policies and practices for recommendations that we can consider going forward.
The OPEGA report will focus on how the state is protecting kids during the initial investigation and assessment, and how it's protecting child safety during the reunification process and permanent placement in a foster home. Members will also review the system's oversight and report back to lawmakers in early January. Diamond, in the meantime, says years of promises to improve a system meant to protect the most vulnerable.
I've heard 7 different commissioners say that, and 4 different administrations say that,
are now ringing hollow. Vivian Lee, News Center, Maine.
The investigation by Casey Family Services is expected to be complete by mid-October and will be presented to lawmakers. You can find more information on that DHHS report on child deaths in Maine going back 14 years on our website and our mobile app.